Good evening, everyone, and you're again very welcome to this UK FPO webinar on sustainability in healthcare. My name is Ruth Eakin, and I am Deputy Director of the Northern Ireland Foundation School. I'm absolutely delighted that the speakers tonight are two of our resident doctors, Victoria and Fionnán. I've previously heard them present on this topic to our regional cohort of foundation doctors, and it went down very well indeed. So I do hope you enjoy it just as much. There'll be the opportunity to interact via Mentimeter throughout the presentation, so please have your phone ready to scan the QR code, or alternatively just Google Mentimeter login and put in the 8-digit code to be able to participate. We're very keen to hear your opinions as we go along, so please do use this. And also the Q&A for questions or comments, which we'll come to after the presentation. And finally, there'll be an option to give Victoria and Fionnán feedback at the end of the presentation, which they would really, really appreciate. Sustainability, as we know, is such an important topic. And in fact, there was a previous UK FPO webinar titled Sustainability and Quality Improvement back in September 24, about 18 months ago. And it was delivered by an education fellow from the Centre for Sustainable Healthcare. It's still available for viewing on the UK FPO YouTube site, and we'd certainly recommend that you do have a look at it. This webinar is also being recorded tonight, so both of them will be available for anyone unable to attend this evening. Tonight's content is not a repeat of the last one. In fact, in my view, it's actually a natural progression, and it brings to your attention the Planetary Health Report Card. This is a metric-driven initiative originally started up by medical students at the University of California back in 2019. And in just a few years, the concept has expanded exponentially, and it now includes more than, I think, 180 medical schools across over 20 countries, and 26 of these medical schools are actually in the UK. Better still, over 3/4 overall have recorded improvements in the metrics year on year, but you're going to hear all about it from our speakers. And the final thing I'll say, when Victoria and Fionnán first presented this topic to us in Belfast a couple of years ago, Fionnán was a final year medical student at Queen's and Victoria an F1 doctor. So now I'm going to hand over to the experts and I'm going to let them introduce themselves, starting with Fionnán. Thank you.
Perfect. Thank you very much, Ruth. I will preface this by saying neither myself or Victoria are experts, but we will certainly do our best to give everyone an introduction. So, as Ruth very kindly introduced, my name's Fionnán. I am an F2 doctor, currently working in paediatrics, and I'm joined by Victoria, who is a clinical fellow doctor in palliative medicine. So, our talk this evening, as Ruth has said, is going to be about sustainability. This is an increasingly important issue within healthcare, and it's something that's going to become more and more part of our practice. So, what we really want to achieve this evening is to give everyone a bit of an idea about what it means and how we can implement it into our practice and as foundation doctors. So as we move on, I'm just going to talk about what the talk this evening will include. So we're going to break it down into a few different areas. So initially we'll give a bit of introduction about what sustainability means. What does it mean in the context of healthcare? What's planetary health? And Victoria will also discuss the Planetary Health Report Card. I will then talk about the three main types of sustainability, being environmental, social and economic, giving us a bit of more information about what they involve. And then Victoria will close with some practical tips that we can take on board as resident doctors, foundation doctors, to implement this into our practice. And then we will finally end up with a Q&A. So as Ruth has said, we will be using Mentimeter along the way and towards the end. So the code is just on screen. I'll give everyone a wee minute just to join. This will be anonymous. We encourage any ideas or thoughts to be put in through the Mentimeter, and we'll also be using it for the Q&A at the end. So if you have any thoughts or ideas along the way, please feel free to jot them down, and we can come to them at the end. We will also have the Q&A function in the Teams chat as well, for anyone who has any questions. So I'll give everyone another wee minute to join, and then we will make a start with our first question. So yes, as I said, just join as much as you can, and we will be using it along the way. I think that the code will stay on screen for the duration, so even if we move on to the next part, I think the code will stay on and we can still join. Perfect. So the code's still there for anyone who wants to join, but for anyone who's in, just to kind of get a baseline of where we're at, if we could put down any words or phrases that come to mind whenever you hear sustainability and healthcare. Those could be things that you've seen from your practice, or just any ideas you have what it means to you. Me and Victoria have done deliver this talk a few times, and there are definitely some common themes that come up each time, but there are always some interesting ones that we get along the way. Yes, eco, green, waste. Waste is a big one. It's the one. Waste and energy are the two most common ones that myself and Victoria see when we're giving this talk. But I suppose, is there any other ideas, maybe in practice, medicines, anything else that you can think of? I'll give everyone another wee minute to put some more ideas in. Anything at all. It doesn't have to be too high detailed. Oh, okay. Waste. I think if it gets bigger, I think that means that multiple people have put it in. So yeah, that is the common one. I think I think it just takes me a minute for them to load up. So yeah, preventative medicine. Yeah, perfect. Okay, that's a really good one. We'll be talking about that towards the end. Single-use plastics, longevity. Perfect. Great. So some really good ideas there. Good baseline. And we will kind of cover those as we go along. So if we start to get a bit of an idea about what sustainability is, this is a short wee video that we have that covers the topic nicely, and then I will hand over to Victoria at the end of this video, who will talk a bit more about what planetary health and sustainability are.
The concept of sustainability first appeared in the Brundtland Report, published in 1987. This document, which was also referred to as Our Common Future, was elaborated for the United Nations in order to warn about the negative environmental consequences of economic development and globalization. It was written with the aim of offering solutions to the problems arising from industrialization and population growth. Today, sustainability tries to secure present needs without compromising future generations. How? Without giving up any of the three essential pillars: environmental protection, social development, and economic growth. Sustainability is concerned with assuming that nature and the environment are not an inexhaustible resource, and so it is necessary to protect them and use them rationally. Sustainability promotes social development, seeking cohesion between communities and cultures to achieve satisfactory levels in quality of life, health, and education. Thirdly, sustainability focuses on equal economic growth that generates wealth for all without harming the environment. Nowadays, many of the challenges that humans face, such as climate change or water scarcity, can only be tackled from a global perspective and by promoting sustainable development. Now that you know what sustainability is, remember to act in the present, thinking about the future.
Thank you, Fionnán. So hopefully that has given you an idea about sustainability. I'd now like to introduce another concept: planetary health. And really, if we're talking about health on the simplest level, we think about health for an individual, and it's something that we'll consider every day as foundation doctors. We're thinking about individual patients with infections, with chronic disease, and considering their individual trajectories. If we move up another level, we may consider public health, especially if we're working in a setting such as GP, where we'll think about not only the health of one patient, but of the population. We might consider ideas such as vaccines or notifiable diseases. If we move up to the next level of health, we can think about global health. And hopefully you will all have some understanding of global health from medical school, where we're aiming for equity in health, equal access to health, and acknowledging that obstacles to health differ among populations and among socioeconomic groups. If we move up to the next level of health, we can think about One Health. And this is really a very Americanized term. I've very rarely heard it used this side of the Atlantic. This is a term that includes not only human health, but also animal and livestock health. And we can think about things like antibiotic use in livestock and the impact on antibiotic resistance, not only in the animal populations, but also the impact in human populations. And finally, moving up to the last level, we can think about planetary health. And planetary health encompasses all of the previous levels that we've spoken about, the health of all humans, of all animals, but also the health of the planet, including its natural resources, ecosystems, and the impact of climate change on these. So why does planetary health matter? Why should you care? You can see here some really significant headlines, and the headline is climate change has serious implications for our health and for the health of our planet. The WHO predicts that between 2030 and 2050, climate change could cause an additional 250,000 deaths per year. An additional 250,000 deaths per year. This is the biggest health threat facing humanity in this century. And therefore, planetary health matters to all of us. It affects all of us, and it affects all of our patients. This is a mutually detrimental situation. Climate change worsens health outcomes, which creates more demand on the NHS, and the NHS also has huge carbon emissions, which worsen climate change. And Fionnán will talk a little bit more about the NHS emissions later. I'd now like to take a little sidestep to talk about how Fionnán and I got interested in planetary health and sustainability. And Ruth, in her introduction, spoke a little bit about the Planetary Health Report Card. So this is an international sustainability audit that was established in 2019, originally just for medical schools, but has since expanded each year and now encompasses 10 disciplines, including nursing, physio, dentistry, and so forth, in nearly 200 universities across 21 countries. Each school is audited on the 5 domains that you can see there, and is then provided with recommendations. And lessons are shared globally, and good practice is recognised. So we can look at the map on the next slide with the Planetary Health Report Card data. And the data is released each year on Earth Day in April. Fionnán and I have both implemented and chaired the Planetary Health Report Card group at Queen's here in Belfast, and have also chaired the subsection of the UK Planetary Health Report Card. Queen's and Belfast are relatively high scorers in the UK and Ireland. You can see our little dot there, and that's partly because Fionnán and I have been able to shape the new curriculum at Queen's. Each geographical area will have a report card, so you can go on and view the report for the USA, for the UK, for Ireland, for Australia, and you can see the top scorers in each area. I would really recommend going and having a little look at their website and keeping an eye out on Earth Day for this year's results. And Fionnán and I are very happy to receive emails about this, especially if you don't see your medical school involved and you would like to get your medical school involved. We would love to hear from you. So really, the idea is that planetary health is a complex relationship between health and healthcare and the environment. And we all, as foundation doctors, are considering holistic healthcare. We will consider the biological, the psychological, and the social factors on health. And I would implore you to also consider the environmental factors on health. There are measures that we can take which will consider planetary health and sustainability, and those measures should form part of our everyday practice in order to provide truly holistic care. And we will talk more about some practical steps that you can take later in the webinar. We have a video coming up next, another short video. Thank you.
When we think of the NHS, we think about making people better. What if we told you this fantastic work had the potential to make us unwell? Inefficiencies and rising demand are putting a strain on our finances, and our environment. On average, NHS-related traffic equates to travelling around the world 1,000 times per day, reducing our air quality. What we use and how we dispose of it produces greenhouse gases. This contributes to climate change, putting our most vulnerable at risk. As guardians of health, we have a responsibility to consider the environment in our everyday decisions. This will protect patients and potentially the NHS's purse. We challenge you to find ways to make the NHS green. Reduce, reuse, recycle. For more information, visit the RCP website.
And I really would encourage you to think about that last challenge there. How can you make the NHS more green in your work and your practice? So I'd now like to revisit sustainability, and particularly sustainability in healthcare. If we go back to the last slide, we can see the Sustainable Development Goals, and these were created by the UN members in 2015. The aim of these goals is peace and prosperity for people and the planet. These are inclusive goals. They are for all countries, not just developing countries. And you will note that number 3 is good health and well-being. So health in and of itself is a sustainable goal. However, if you look through the others on that slide, you will see that good health cannot be achieved without many of them. 2, zero hunger. 5, gender equality. 6, clean water and sanitation. 7, clean energy. 9, industry and infrastructure. So these sustainable development goals are interlinked, and achieving one relies on achieving others. Sustainability is not something that we should think about once a year in a 1-hour lecture like today, but something to think about in every day, in every area of our practice, if we want our patients to have good health and well-being. We want to meet the health needs of today's patients without compromising the ability of future generations of patients to meet their needs. And the Royal College of Physicians has identified sustainability as a domain of healthcare quality, quote, which must run through and moderate other domains. And you can see those domains of healthcare quality there: safety, timeliness, effectiveness, efficiency, efficacy, patient-centeredness. Sustainability is not a standalone subject, but something that should run alongside and moderate everything else that we do. So as our first video highlighted, there are 3 main pillars of sustainability. Hopefully you will now have a greater understanding of sustainability and planetary health and why they are important. So I'm now going to hand back to Fionnán, who will take us through these 3 pillars in more detail.
Thank you very much, Victoria. So yes, I'm just going to talk through each one and a little bit of information and give us a kind of baseline of what they mean. So the first, and I suppose probably the one that springs to mind most when we talk about sustainability or green, we hear the phrase and we think about the environment. So as the name says in the tin, environmental sustainability has got to do with the environment. When we think about that in terms of health, we are a product of our environment. We rely on food systems, water, air quality. These are all things that are part of our environment that will affect our health. And we are already seeing that environmental degradation and climate change is having an impact on our health. We're seeing more frequent weather events, droughts, floods, damaging infrastructure. We are now seeing environment-related diseases on death certificates, air pollution-related lung disease or heat stroke from more severe temperature events, things like that are already affecting our health. So it's incredibly important to understand the impact of environment and climate change on our health. But on the flip side, it's equally important to understand the impact of healthcare delivery and the care that we give on the environment. So the NHS is the largest public body emitter of carbon emissions in the UK. In fact, global healthcare as a sector is the fifth largest, or excuse me, if it was a country, it would be the fifth largest carbon emitter in the world, just after Japan. So the NHS as a body is a huge producer of carbon emissions. 5% of all transport in the UK is NHS related. And you can see in this infographic, when we think about the source of emissions, we oftentimes think of waste. We spring to clinical practice, we think of all the single-use plastic and everything that has to be burned. That is about 5% of all the carbon emissions. So if you think of that vastness, and that is only a 20th of the total emissions. And just above that in the infographic, you'll see that MDIs and anaesthetics alone produce the same amount of carbon as all the water and waste in the NHS. And it's just an example of how something so kind of common and we see it all the time has such a big impact. And it can be dealt with and make a much more positive impact on those carbon emissions. And another reason why it's important for us to know about is that the NHS has a goal to be carbon neutral by 2045 or net zero by 2045. So it's something that we will see coming into policy and into practice in the coming years. And the GMC also mandates that we as doctors are aware of this as an issue. In their most recent outcomes for graduates, they've put an understanding of the impact of the environment on our health and the role of the health service on the environment as something that all newly qualified doctors should know about. So as the kind of point of this talk is to make us all aware that this is going to become more important in our practice in the years to come. So this infographic is come from the same data as the pie chart in the previous one, and it's just to give more information about where these carbon emissions come from. So we tend to divide carbon emissions into three main scopes. The first scope is direct emissions, so that is what produced by the NHS through the burning of fossil fuels. So for example, to produce heating in NHS facilities or from transport of NHS vehicles, so things that the NHS burns directly. Scope 2 is indirect, so that's basically the electricity that is obtained from the burning of fossil fuels. And those are two things that the NHS has direct control over. How much fuel are they burning? How much electricity are they using? And whilst it's not necessarily accessible to us as foundation doctors, it's something to be aware of. And then scope 3 is the much larger sector, and these are things that whilst the NHS doesn't have control over it directly, they have a huge impact. So for example, all of the medicines that we use, whilst we as the NHS don't have control over the production lines and what energy they use to produce the medicines, we do have control over how we prescribe. Are we prescribing efficiently? Are we deprescribing? Are we evaluating each patient's needs and kind of minimizing prescriptions from a resource point of view? Are we minimizing our waste? Are we providing more efficient travel options for patients and staff? So it just shows that there's a huge breadth and different ways that you can get involved at every level of your practice. It doesn't necessarily need to be a policymaker or a trust director, but something that we can all get involved with, and there's a need for all of us to get involved with. So as a positive example of environmental sustainability in healthcare, we have this case study from Great Ormond Street Hospital, a name I've become very familiar with from my time in paediatrics. So they have a really excellent sustainability plan, and they have really integrated it into their core principles as a hospital. They've put it up there with all other aspects of clinical care, and in their plan they've some great ideas about waste recycling, about green spaces, becoming more fuel efficient. But what it really highlights is that it is something that we can put at the core of our practice. It doesn't need to be non-clinicians leading this, but we as doctors should be at the front line of this, advocating for patients both now and in the future. I suppose as a paediatric hospital, they understand that this is the children's future, this is everyone's future, so perhaps maybe that's why they're frontlining it so well. But it's something that we can really make a part of our clinical practice and not just something that we can leave to someone else. So I'm going to put the question back to everyone else. So if you can think of any initiatives that you've noticed in your trust or your health board or your hospital that you think are a good example of environmental sustainability. It doesn't necessarily need to be something, again, in any great detail or any great depth. Oftentimes we find is that things done for other reasons, for cost or for efficiency, will have a positive impact on the environment. I don't know if it's the options coming up for the... I think we might need to go to the next slide. I don't think the options are actually coming up for people to answer, or maybe it's just me. No? we have? Okay, are we able to put the answers in? Yeah, I think we need to maybe go on to the next one. Perfect. Oh, okay. So yes, have you noticed any initiatives in your trust? As I said, this could be something simple like deprescribing medications. It could be the gloves off policy. Some trusts have adopted appropriate use of PPE, offering public transport vouchers to staff or patients to make it more accessible. Anything at all. Okay, so a few maybes, a few yeses, some nos. Okay, good. So hopefully there's something going on. Great. Yeah, I suppose maybe that things might be going on that you haven't really realised, or you're wondering, is it being done from a sustainability point of view? And oftentimes it mightn't be coming under that umbrella, but it is making a positive impact. So okay, good spread, but more yeses than nos, which is great. If anyone wants to give any examples, that would be brilliant. If you've said yes to the previous ones or some maybes, as examples, that would be great. So we'll just give a wee second. A staff bus, brilliant. Yeah, I know that's something that, and I work on the Royal side, and I know they offer a bus from 2 different hospital sites, which is free for staff, and I think patients as well, but I'm not sure. Yeah, turn off lights. Something so simple, when you're leaving. I know a lot of the lights are automatic, but something simple like turning off lights or turning off equipment can make such an impact on energy usage. Gloves off policy, again, minimizing use of PPE, minimizing use of single-use plastics, CFC inhalers, probably a big thing. If anyone works in GP, you might be seeing more and more of it. I know I've seen it a lot in pediatrics when we're starting children on inhalers. People are advocating, pharmacists are advocating for CFC-free inhalers, which is brilliant. I highlighted on the previous one, a huge source of carbon emissions. Bike maintenance, brilliant. So transport-related ones, lights off, inhalers, brilliant. Windmill, yes, I don't know if that's a local one. There was one on the Antrim Hospital site. There's a windmill there. Single use. Oh, okay, I haven't heard of the eye drop one before. That's a good one. On public transport. Perfect. So some really good ideas there. I'm glad it's reassuring that something's going on. So that was sort of an environmental point of view. So coming on to the next theme of sustainability, we talk about social sustainability, and this has all got to do with people and communities, understanding that no patient functions solely as an individual, and that their community and their background and their socioeconomic background will affect their health, whether that be exposure to smoking, exercise, alcohol, access to health services, reducing those inequalities. But also what is their kind of relationship with health and healthcare delivery. So from a patient perspective, that's social sustainability, but also from a workforce and a staff perspective, at the end of the day, the NHS workforce is a body of people, and we need to look after our staff in order to sustain the workforce in the coming years. And I know this is something that's very topical, and I'm sure all of us are very familiar with workplace culture and issues with NHS staff and kind of our value as staff. So it's something that needs to be considered as well. And the infographic on the right, I think, is a really good summary of it. So equality and diversity, or I suppose a better phrase might be equity and diversity, understanding that people come from different backgrounds, different socioeconomic backgrounds, different ethnic backgrounds, and that will have an impact on their approach to healthcare, their accessibility, their kind of response, and their how much they're willing to participate with healthcare, and potential barriers, and about mitigating those as much as we can as clinicians. Quality of life, ensuring that everyone, I said, has equal access, and reducing and preventative medicine, and understanding that dealing with the root cause is much more effective and much more sustainable than the downstream effects of that. Social cohesion, again, promoting community well-being, making sure individuals are being able to function as part of their community and not feeling isolated, has a huge impact on mental health. And finally, democracy and governance, which is understanding that everyone should have a voice. Both staff and patient populations feel as though they're being listened to and that their issues are being heard, and also that resources and time are being distributed fairly amongst different patient populations and not felt to be distributed unnecessarily or unfairly. And this definition, I think, just sums up what I've talked about, which is basically about trying to minimize and mitigate those disparities, those systemic disparities in health. And anyone who studied epidemiology as an undergrad or postgrad will be very familiar with this concept about inverse care law, and minimizing health inequalities as kind of upstream factors for determinants of health. And it's something that I suppose we're probably better at dealing with maybe than the environmental side of sustainability. It's become more and more a part of our practice, and we have our biopsychosocial model of healthcare. So it's something that we're all very familiar with, but it's still something that we need to carry on and develop and improve. And as another example of how this has gone into practice, we have the NHS's long-term care plan, which came out in 2019. I see it was when I was doing some more research for the talk, I see that NHS England has also produced an updated one in 2025 about a 10-year plan. But essentially, this was our plan and main goals as the NHS going forward. What are we prioritising? And of the 7 chapters, 2 of them were linked to social sustainability. So chapter 2, which is focusing on prevention and health inequalities, main ones being smoking, alcohol, air pollution, nutrition, exercise, green spaces, and how different socioeconomic groups have less access to those, improving that and trying to get everyone closer to a baseline level of health that is fair and equitable amongst different populations. And also they had a separate chapter on staff wellbeing, and again understanding that we as a workforce are a group of people and our health needs to be maintained as much as the patient population. Perfect. So going back to the group, we did say this was going to be interactive, so we're really putting you all to work. So I think if we go on to the next one again, that should be the question. So I don't know if we have access to it. Perfect. So any initiatives you've noticed in your hospital or your trust to promote equity from a patient point of view, or alternatively from a staff point of view, improve mental well-being or physical well-being amongst staff. And as I say, I suppose as the current NHS workforce, I'm sure we would all have ideas about staff health and well-being. So if you've anything you've noticed that has tried to promote this within your trust, I would be very interested to hear. And I think there's a delay. Perfect. Yeah, great. So we have regional guidelines about antibiotic use. Good. I suppose if there's any other upstream factors maybe you've noticed to try and mitigate those disparities in socioeconomic health, have you noticed any initiatives to provide more accessible healthcare or target those groups that traditionally might have been disadvantaged, to try and treat those upstream factors at all? Good. I think this is something that some GPs offer, but yes, gym vouchers and kind of that health prevention or health promotion. Okay, yes, I suppose that's probably a thought that's shared amongst a lot of staff, that we can feel at times as though well-being is undervalued, and that as the NHS has come under more and more pressure, the staff are often felt that we are the ones that need to meet those extra pressures ourselves, and sometimes have to put ourselves on the back foot. And I suppose that's what we want to highlight, is that this is something that needs to be dealt with just as much as the patient population. Equity and diversity training mandatory. Good. I suppose the thing with training is often, if it feels mandatory at times, I don't know what engagement is like. Sometimes when things feel like a tick box, they can be maybe not as engaged with as other things, but I suppose it's still important for us to have. So some good ideas there. Thank you very much for sending them in. So I'll talk about our last aspect of sustainability, and then you'll be glad to know that's me finished. So economic sustainability is got to do with finances and cost and resource procurement. And I suppose on the surface of it, we might think that as foundation doctors, what has this got to do with us? And we don't decide where the budget goes. We don't decide what gets bought. We don't decide the cost effectiveness of different things. But there are simple things that we can do on the ground that have a huge financial benefit to the trust. And this one is so extractably linked to the previous two. If that you were going to try and improve environmental or social sustainability, you will in almost every instance have a positive impact on finances. So for example, if we think about waste reduction from an environmental point of view, if you're using less resources, if you're wasting less materials, then by default the trust is paying for less materials. So therefore you have an economic benefit. If we think about tackling upstream determinants of health, if we were to promote smoking cessation and minimise the amount of the population that smoke, compare that cost-wise to dealing with the health-related issues of smoking, of lung disease, COPD, lung cancer, other physical, it's linked to every other kind of health you can think of. Think of the appointments, the hospital admissions, potentially intensive care admissions, surgeries, medications, all of that has a cost. And if we were to tackle it at its root from a social perspective, you would automatically have a positive financial impact. So there are things that we can do as foundation doctors that have an impact. And that little infographic on the right is just an example of how we would move away from a linear economy, which is a sort of obtain the resource, use the resource, dispose of the resource, which is a one-way system, not very efficient, not very sustainable, to a more circular economy, which is about reducing the amount of things that you obtain. It's about reusing and finding different uses, making the process more efficient from a resource point of view, but also from a cost point of view. But again, I suppose that's probably above our pay grades, but there are definitely things that we can do. And I will hand back to Victoria, who will give you some practical tips for things that we can do as foundation doctors to make our practice more sustainable. So just before we do, yeah, there's a wee question.
Yes, thank you so much, Fionnán. I'm going to ask you to jump onto Mentimeter one more time and let us know any ideas that you have for implementing sustainable healthcare into your practice, your everyday in the NHS as foundation doctors. And we're really looking for specific examples here. What could you change today, or what could you change this week? And I'll give you a couple of minutes just to pop in some suggestions. Oh, reducing unnecessary tests. Yeah, absolutely. That is a really good idea. And I'll talk about that a little bit in one of the next slides, but absolutely. Walking, cycling, public transport to work, definitely. Inhalers, yes, we've talked a little bit about the impact of inhalers on the environment, and similarly, if you're working in anesthesia, definitely prescribing the right inhalers, not bringing multiple needles when attempting venipuncture. Yeah, most get thrown in the bin. Reducing daily bloods, absolutely. Do patients really need that daily CRP, or could we do it less frequently? Absolutely, let's base it off guidelines. Sorting waste and avoiding wastage, yeah, perfect. Stopping medications that patients aren't taking, yeah. I have heard stories of patients being prescribed many medications from their GP, and the GP doing a home visit and opening the kitchen cupboards, and there was about a year's supply of medication. So yeah, having those really important conversations with your patients about their medications so that you can benefit the patient but also benefit the environment. So thank you so much for those comments. Those are fantastic. We're now going to talk through some hopefully really practical tips for you as foundation doctors and how you can implement this into your everyday. So thinking still about those 3 pillars of sustainability. First of all, environmental sustainability. And for me, I think environmental sustainability is the easiest to think of in terms of how we can make changes, but sometimes is the most difficult to actually implement. We've spoken about some of these in the last Mentimeter. So avoiding unnecessary single-use plastics, thinking of your gloves off campaign, disposing of clinical waste appropriately, public transport to and from work. These are all really important things, and Fionnán and I have given this talk a few times, and those are the big things that come up every time. And they are really important, don't get me wrong, but there are big challenges associated with all of those. For example, cycling to work or getting public transport to work can be challenging if you're working, the shift patterns that you are as a foundation doctor. There can be issues, certainly in Northern Ireland, there are issues with recycling bins in clinical settings where they just don't exist. There's an option of either a clinical waste bin or a general rubbish bin, and no recycling is available. And you can think about I suppose the thing that I would encourage you to think about as a foundation doctor is that medicines account for around 25% of carbon emissions in the NHS. And there are some really very easy swaps. So of course, think about your green social prescribing, your exercise, nature, community schemes. What can you do as a foundation doctor? And certainly something that was mentioned there in the last Mentimeter about medications. And do patients really need those medications on a regular basis, or could they have them PRN instead? So I'm thinking about things like QDS paracetamol, QDS cocodamol, nightly sleeping tablets. Do they really need them on a regular basis? Or if you prescribe them PRN, would that reduce usage, reduce waste, reduce transport, reduce manufacturing? One of my favorite swaps, one of my favorite examples of a swap is oral iron. And apart from certain specific populations, such as in pregnancy, oral iron has been shown to be just as effective when given on alternate days, every other day, as it is when given daily. So if you prescribe your oral iron every other day instead of every day, you're going to have half the number of tablets, half the waste, half the transport, half the manufacturing, half the energy. That is huge, and it's a really easy swap to make. So if we then think about social sustainability, and I think conversely, these are probably much more difficult to think of good examples of changes, but actually are often quite easy to implement. So we're thinking about things like community schemes, we're thinking about the culture of a workplace, diversity and inclusion for staff and patients, we're thinking about our antibiotic stewardship. And then our economic sustainability. And really, if you're already making changes that are environmentally and socially sustainable, there probably will be a beneficial economic impact associated with it. And really, we are talking less is more here. And absolutely, there were a few mentions there in the Mentimeter about, do you really need all of those investigations? Could we have fewer investigations, fewer tests? Could we deprescribe? One of my other favourite examples here is about breastfeeding. And, not every mother will be able to, but really about providing the support and the structures in place so that breastfeeding mothers are able to breastfeed. And if you think about, the sheer equipment that is required to bottle feed a baby, and the packaging, energy, transport, manufacturing associated with all of that. Also, breastfeeding, not only will you save on all of that, you will have your beneficial antibodies, thinking about your preventative care for your future generations. A really easy swap if we can provide the right support. And then just some general tips. Hopefully by being here tonight, you're already interested in sustainability. If you don't know how to get started, I would say advocate for sustainability in your team, wherever you are now. Get involved in sustainability initiatives in SUSQI, and don't be afraid to educate other staff members and patients and encourage them to get involved. I probably know more about this than a lot of my consultants, and that's because partly of my age, partly because of my training, that this was part of my undergraduate education, partly because of my interests. So don't be afraid to be that person to stand up and educate the rest of your team. I'd now like just to finish off by talking about a potential really, really easy SUSQI project for you as foundation doctors. So thinking about a task that you will be completing regularly, intravenous cannulation, and the clinical waste that is produced from just one cannula insertion. Somebody on the Mentimeter talked about the number of needles that they're throwing in the bin. So how can we reduce this waste? We could use a reusable blood pressure cuff instead of the disposable tourniquet. We could only open the actual cannula that you're about to use, and just as importantly, put the unused ones back into the supply drawer or cupboard. Coordinate with your venipuncture to avoid repeating procedures, and label your cannula with a date and time to reduce the frequency of repeating that procedure. You could calculate the minimum amount of equipment required for each cannulation versus how much was actually used. You could audit that. And you could go on to calculate the money lost and the mass of additional waste produced. This is a really frequent task if you're working in hospitals. Patients are being cannulated all the time. And because of that, there could be an enormous impact from just this one simple procedure. So sustainability in QI, SUSQI, it is an approach to improving healthcare in line with the Sustainable Development Goals in a holistic way and by assessing quality, thinking about the Royal College of Physicians, and looking through the lens of that triple bottom line, those 3 pillars of environmental, social, and economic. In SUSQI, we want to embed the principles of sustainable clinical practice, thinking about prevention, patient empowerment, and low carbon alternatives. SUSQI is not a replacement for traditional QI, but is designed to embed sustainability into current QI practice, and therefore provide practical tools to help transform our NHS, to make our NHS more green. And as Ruth said right at the very start, there is a previous UK FPO webinar specifically talking about SUSQI projects. I really encourage you to go and have a look at it. You can find it on YouTube or on their website. It's a really good watch. And as has been alluded to, it's very likely that this will become a mandatory part of the curriculum in future. So that is the end of our talk. Thank you so much to everyone for listening. Please feel free to submit any comments or questions on the Mentimeter or in the Q&A function. And Ruth, if we just skip through the next couple of slides, we have a feedback link, which we'll go back to. Would really appreciate if you could give Fionnán and I some feedback. We are both still very junior, so anything that you have to say about this, we would love to hear from you. We have some more links as well for information resources, which are really helpful if you want to learn more about sustainability, if you want to get involved in SUSQI. I would particularly signpost you there to the Centre for Sustainable Healthcare, who have some great resources, specialty specific resources as well. They have example SUSQI projects, really fantastic resources there. These slides will be going up online, so do feel free to get these QR codes at a later time as well. And if we go right through to the last slide there, Ruth, both of our emails are there, so we would love to hear from you. Any questions, any comments, and there's the QR code for the Planetary Health Report card there as well. Thank you very much.
Thank you very much, Victoria, and thank you, Fionnán, for a fantastic presentation. Really, really enlightening, really going over very, very important things and giving lots of tips and ideas to all the people who are getting to listen to this. I think, we'll have a look and see what questions are coming through or what comments are coming through. But we do have a few minutes if you want to put some comments or questions in the Q&A, or we can go back to the Mentimeter one as well. But I mean, one thing I would say, or at least put to you, is I want to ask you a question because it's relating to something that you commented on there, Victoria, that something like this may become mandatory in the future. So I'm not going to say very much, but there is a revision to the 2021 foundation curriculum due to be implemented in August coming of this year. So any F1s, hopefully you're listening very carefully. If I hope everybody's listening very carefully, but in particular with relating to the foundation curriculum. So I'm going to ask either of you to answer maybe one of the questions here. So what ideas, what sort of practical ideas? I know you've mentioned some of them there, but what about easy to implement? Because the placement, the posts are generally 4 months. I know there are some 8-month ones in Scotland, which is great. But can you give any sort of pointers to perhaps easier ones to try and implement in a very short time? Because I know you can go on, you can keep at them when you come back, or you can look at things in advance or continue somebody else's project. But can you suggest anything that would be like really easy to implement in a very short period of time in terms of SUS-QI?
Yeah, absolutely, Ruth. I think as with all QI for foundation doctors, it's about, as you say, trying to keep it within those 4 months and trying to have something that's quick and impactful. Fanon and I, from the very start, when we were in Queen's trying to make changes to the curriculum, we really spoke about low-hanging fruit and what could we achieve quickly and easily to get the momentum going and to keep momentum. And as with any QI project, the best one that you can do is the one that you see in your daily practice. So I, at the moment, am working in a hospice where we use a very large amount of syringe drivers. All syringe drivers are run off a 9-volt battery. And I one day was walking past our medication room and saw boxes and boxes and boxes and boxes of not sponsored by Duracell batteries, and thought, this is crazy. So I have now done a QI project, really quick turnaround to reduce the number of batteries that we use. Quick and easy is the best. There is, in the previous webinar, the Sustainability QI webinar, there's an example about venipuncture and how to do a QI project on that. Like I said, there are loads of ideas on the Centre of Sustainability Healthcare website as well.
Brilliant. Thank you very much, Victoria. I'm going to ask Fanon another question here. Whenever you go to do these, obviously you're looking for some senior support. That's always helpful. But as you rightly said, very often you are the people who have the ideas and the know-how. But how do you encourage your senior colleagues, or even the leads of your department? How do you encourage them to support sustainable practice and initiatives on a practical basis?
Yeah, and actually I just saw in the Q&A, I think there's questions just come through, something very similar about how do we get consultants involved, as juniors. In my experience, they're generally very receptive, and they're very happy that it's not something that they necessarily would have studied or been taught about during their education or their practice. So they're normally unaware but very open to the idea. I have found that phrasing it in a way that seems familiar to them is the best way. So rather than saying, can we make prescriptions more sustainable from an environmental point of view, one of the things that I suggested in my last job in acute medicine was to say, look, can we rationalize prescriptions? Are we over treating patients? So you're not phrasing it from a sustainability point of view, but it has an impact on sustainability. So I suppose making it in language that they're familiar with from their own specialty. A lot of consultants are very familiar and comfortable with and passionate about their specialty. So if you can phrase it in a way that seems interesting to them, but ultimately I suppose you can have an ulterior motive, which is from a sustainability point of view. But that's the great thing about sustainability. It doesn't have to, everything doesn't have to come with a green label on it. Any sort of improvements from efficiency or efficacy point of view are going to improve sustainability. So really just the phrasing can make all the difference.
Brilliant. And you're right, the question that's come in very much related. It might be in the foundation curriculum, or it might about to be in the foundation curriculum, but how do you get the older consultants on board? Well, supervisors are supervising what you're doing. You've got clinical supervisors, you've got education supervisors, you've got foundation training program you've got FPDs, foundation program directors as well, or foundation training program directors, FTPDs. So all of these people are being, are fully versed in what is in the foundation curriculum, and they will be fully versed, as will foundation doctors, in the coming months when loads of material will be produced on the UK FPO website to make it absolutely crystal clear what any changes are and what the implications are. And sustainability is highly likely to be commented on in those. So look out for the UK FPO website materials on the revised curriculum over the next few months coming up to August. There'll be plenty of information there to make it as easy as possible.
I think, sorry, Ruth, I think the other
thing
is that, we want sustainability to be a domain of healthcare quality, and therefore we want it to still have patients at the centre. we want patient care to be the utmost priority. So any of these changes that you're making, they should be benefiting patients as well. And therefore, I think as long as you're still ensuring that your patient is at the center and that their care is not going to be sacrificed as a result of this sustainability, in fact, it should be benefited as a result, then, how can people not be on board with you and with your projects?
Excellent. So there's another question that's come in that be very interested in your response. The Planetary Health Report Card is well established in medical schools, and we've talked about that, and Victoria, you particularly went through that, and it is really, really brilliant. But the question is there a standardized version currently being rolled out at trust level for us to use in our current rotations? So you may only know what's going on in a bit more about what's in Belfast. This question has come in from London. So are you aware of what is standardized throughout the 26 medical schools in the UK?
In a word, no. I suppose
Fair enough.
we are. So like you've said, it's part of the GMC outcomes for graduates. I attended with a number of PHRC cohort a couple of years ago to the GMC to push this forward in the undergraduate curriculum as well through the GMC. The issue that Fionnán and I have found with sustainability is that there are generally lots of individual people or pockets of people doing their own individual drives for sustainable healthcare, and there's very little kind of link up between, there's very little national measures to kind of be guided by. I suppose that hopefully the PHRC is a start in that we now have a generation of students who are graduating with this knowledge and having completed this audit. In terms of, I suppose, networking with others who are completing their own sustainability initiatives, there are a number of specialty specific networks. I believe through the Centre of Sustainable Healthcare. I know I'm part of the palliative medicine one, but there's one for almost every specialty. So I suppose what I can recommend to you, Dr. Sporenberg, is to join the one that's specific to your specialty. NHS England, I know, did have a little bit more progress than Northern Ireland in trying to have a joined up effort towards net zero. I believe that has slightly fallen by the wayside now, but you're probably further ahead than we are in Northern Ireland, to be honest.
Excellent. We're almost done. I'll just maybe give either of you a chance to maybe say anything about any further tips on actually practicing sustainable medicine, any additional tips that you haven't already said on a day-to-day basis.
Yeah, I mean, I can give us my kind of approach to sustainability is honestly simple things, small and simple. Less is always more. Day to day, small changes here and there, medications, transport, even just understanding that health is not just about the individual. Even just having that understanding, educating patients and staff, having those conversations can be of huge benefit. So honestly, just whatever small way you can, simple often, and less is more.
Yeah, for me, working in palliative holistic medicine is my passion, and holistic medicine for me, as I think I said earlier, includes sustainability and really keeping the patient at the forefront. I have conversations with patients every day about what interventions they do and don't want, and in my experience that's something that's not done very often except in palliative care, but that in itself is a sustainability initiative. So absolutely the individual patient, and like Fionnán said, any little changes you can make, get those low-hanging fruit and keep the momentum going.
Brilliant. So it's really about bringing it up to the consciousness and having it there really throughout your day 24/7. So I'm going to bring it to a close. I want to say thank you very, very much to Victoria and Fionnán for a fantastic session, and you will still have opportunity to give them feedback as well. if you want to make contact if you didn't get that QR code. I would like to thank Sophia and James from the UKFPO for all their and Kata for all their behind the scenes support and administration that allows this webinar to take place. And last but not least, I really wanted to give a very big thank you to all of you for attending this evening and for participating. And of course, for anyone who's watching the recording as well, thank you also. So enjoy the rest of your evening. Thank you.